Session 1, Introduction to Minnesota Prescription Monitoring Programs. After viewing this session, you'll have knowledge of PMPs nationally, as well as the history of our PMP here in Minnesota. What is a prescription monitoring program, known as a PMP? You may also hear it referred to as a prescription drug monitoring program, or PDMP. The terms are interchangeable. A PMP is a secure electronic database containing information about dispensations of certain medications, most often those classified as controlled substances. Information related to the dispensation is reported to the Minnesota PMP database and available for prescribers and pharmacists to reference when creating care plans for their patients. For the purposes of this education, a dispensation is defined as a medication that is filled pursuant to a valid prescription and lawfully obtained by an individual for their own use or for an animal under their care. The Minnesota database requires reporting of all state-controlled substances, 2 through 5, gabapentin, and all formulations of butalbital. The basic process of a prescription monitoring program typically begins with a patient being assessed by a provider during a clinical visit. The provider chooses to send a prescription, in this case for a reportable controlled substance, to the patient's pharmacy in Minnesota. When this Minnesota pharmacy dispenses or sells the prescription to the patient, they are required to report the details regarding the drug, the prescriber, the dispenser, and the patient to the PMP in Minnesota. The prescription data resides in the Minnesota PMP for 12 months. If this patient seeks further care, any prescribing provider or pharmacist that is assessing the patient may access that record. They can use that information to supplement what they already know about their patient to decide what is the best care plan going forward. Prescription monitoring programs had their beginning in this country over 100 years ago. At that time, doctors were able to prescribe heroin, cocaine, and opium to be dispensed in pharmacies. New York discovered a growing drug problem, and in 1918, the state passed legislation that included a requirement for doctors to use a serially numbered official prescription blank issued by the state health department when prescribing certain amounts of these drugs. The pharmacy was then required to send a copy of this prescription to the health department within 24 hours. The law was rescinded after 3 years, but it really laid out the foundation for future prescription monitoring programs. Early programs began with a focus on law enforcement. California launched a program in 1939 and is the oldest continually operated PMP in the country. They were followed by Hawaii in 1943, and 18 years later, Illinois was the first to establish their program within the Department of Health. Idaho was the first within the Board of Pharmacy. This is significant because controlled substance issues were then beginning to be assessed as a health issue and not directed right to criminal justice. The first programs all had the following in common. They collected only Schedule II controlled substances, they submitted paper forms in duplicate or triplicate, and they required sending information within 30 days. Once technology was available to collect data electronically, Nevada joined and required the reporting of Schedules 2 through 5. Between 1990 and 2000, there was an influx of implementation where more states developed PMPs during this period than had in the previous 50 years. Today, there are 54 states and jurisdictions with operational PDMPs. This includes Puerto Rico, Guam, the Military Health System, and Washington, D.C. Minnesota's PMP was established in 2010. The Minnesota PMP began collecting data in January of 2010. In April of that same year, the system is open for creating accounts and accessing data. Some other key points in time. In 2014, the Minnesota legislature allows the Minnesota PMP data to be shared with authorized users outside of Minnesota. This enables Minnesota users to also access other jurisdictions' patient history reports. By July 1, 2017, all licensed prescribers and pharmacists in this state were required to register for and maintain a Minnesota PMP account. December 4, 2018, Our program transitioned from our previous software platform called RX Sentry to the new Aware system. With this transition, we were able to secure funds for NarxCare, which is an enhanced view of a patient history report, applying analytics and risk scores to the PMP data. In August of 2020, the Board of Pharmacy secured funding to provide a statewide license to integrate access to view a patient's PMP report with one click from within an electronic health record or a pharmacy dispensing software system. Integration prevents authorized users from leaving their clinical workflow to log in and access their patient's PMP history. This has been very well received, with 2021 introducing the first requirement to review the PMP in certain prescribing circumstances. Additional sessions containing details regarding the statute requirements, multi-state sharing, the NarxCare report, and statewide integrated access will follow. Minnesota Statute Section 152.126 states the intent of the database is to promote public health and welfare by detecting diversion, abuse, and misuse of Minnesota classified controlled substances, acting as a source of information for prescribers and pharmacists, also acting as an investigative tool for law enforcement and medical examiners. The PMP is not intended to prevent people from obtaining needed drugs or to decrease the number of doses dispensed in the state. Minnesota's PMP resides within the Minnesota Board of Pharmacy. The program currently employs an administrator, a program coordinator, a data analyst, and our program director who oversees the Board of Pharmacy's Controlled Substance Reporting section. This section includes the PMP and the Opiate Product Registration Fee Program. There are over 30,000 active account holders, and in 2025, they searched the database over 7 million times. Resources related to this information, as well as all topics PMP, are available on the PMP website at mn.gov/boards/pharmacy-PMP. There are separate tabs under which you can find important information. PMP Searchers contains information for prescribers, pharmacists, and delegates that access the PMP website for patient history reports. Data Submissions has information related to reporting prescriptions to the database. The Integration tab provides information on how to integrate access to a Minnesota PMP report from within an electronic health record, or EHR, or pharmacy dispensing software system, or PDS. Statute Requirements contains details regarding how to remain compliant with the Minnesota statutes when reporting to or accessing the Minnesota PMP. Reports and Dashboards contains current and historic data related to dispensations reported and utilization of the Minnesota PMP. Education is where you can find this and additional quick educational videos. Next is Forms, Resources, and Help. This is where you'll find frequently asked question documents, forms for requesting data or submitting data, and multiple tip sheets. The last tab is Contacts. There's also a link to contact us on each page of the website. Taking a closer look at the Contacts page, here's where you'll find the program phone number, the program email address, and below that, a link to submit a secure request for account assistance. Submitting a request to our program staff for assistance is the fastest way to get help accessing your account. For technical assistance, visit the link to the Bamboo Health Support Center. The next recommended session is number 2, Understanding how the data enters the PMP. Thank you for your participation.